Our first speaker will be introduced by our chairman of pathology, Dr. Cordon Cardo. Carlos?
Thank you very much, Dr. Freeman. Good morning, and thank you for being here in this fourth SINAInnovations conference. This morning is my distinct pleasure to introduce to you Dr. Diego Olego. He's the Senior Vice President and Chief Strategic and Innovations Officer at Philips Healthcare. Philips was founded in 1891 in Eindhoven, in the Netherlands, and it's one of the largest electronic companies of the world, employing over 100,000 people across more than 60 countries. Dr. Olego holds a Master's of Science in Physics from the University of Córdoba in Argentina, and then he pursued a PhD in solid phase physics at Stuttgart University in Germany. Not happy with that, he continued his studies and obtained a Master's in Business Administration from the prestigious program at Columbia University. Dr. Olego was a researcher with the Stauffer Chemical Company, and then he pursued a postdoctoral member fellowship at the Bell Laboratories prior to join Philips in 1986. During his career at Philips, Diego has been holding several important leadership positions in research and management, being now responsible for the innovation strategy, technology investments, and research directions of the healthcare division. In March of this year, Philips and Mount Sinai Health System signed a joint development agreement to create a state-of-the-art digital pathology database and analytics platform to pursue the discovery of new tissue-based tests and enable better care for complex diseases, centering initially in cancer. As Frank van Houten, the CEO of Philips, stated, and I quote, "The digitization of pathology gives us the unprecedented opportunity to access vast amounts of unlocked data. It is our vision that our improved understanding of this data will enable better, more individualized care with greater confidence." And to that, I added that such collaboration has the potential to help drive a new paradigm in healthcare that includes the optimization of treatment efficacy and superior clinical outcomes. Our ultimate goal is to translate data into knowledge so we can maximize the personalized patient management that we are all pursuing. Dr. Olego this morning will delve in such digital innovations in his keynote. Ladies and gentlemen, I introduce to you a thinker, an innovator, Dr. Diego Olego. Thank you for being with us.
Well, many thanks for the very kind words and introduction. It is really my honor and my pleasure to be able to talk to you today. And I'm somewhat delivering this talk on behalf of my boss, Mr. Frans van Houten, the Chief Executive Officer of Philips, who was committed to talking to you, but unforeseeable circumstances have prevented him to being here today. So I'm going to be talking about how digital and digital technologies are making impacts, a little bit at healthcare at large, but we're going to be talking more specifically in the areas of diagnostic and treatment. Now, we are really in a sea of transformation right now around us. So we're departing an analog world and we're moving into a digital world. And we're really astonished by some of the things that are happening. So who would have thought or imagined, let's go back 5 years ago, that maybe in 5 years' time, we're going to have north of 40 billion devices connected in the world. And that's probably an underestimation if we start thinking what's going to happen with Internet of Things when basically everything around us is going to be connected. We're using and we're very active, most of us, on social networking. The penetration of social networking is to such magnitude that depending on how you count, some people say that up to probably 40% of the people in the world today have some type of social networking capabilities. More closer to home, right? So take a look at what is happening with genome sequencing, the speed with which we are processing as well as reducing cost to do proper sequencing. Now, all these fantastic advances in the digital frontiers, at the end of the day, are the results of a couple of fundamental changes that are happening in technology. Exponential growths that have taken place in storage capacity, in network connectivity and number of network nodes, fantastic increase in bandwidth through which we pipe our digital information, and non-stop increases in clock speeds of processors. But underneath all these fantastic progresses, there is just one law that I want to pay tribute to, without which we wouldn't be talking about the digital transformation. And I'm not going to belabor the point, but that's Moore's law. So Gordon Moore, when he then was founder of Intel about 4 decades ago, based on a couple of empirical points, he predicted that the number of transistors per square area on a chip will double, give and take, within 18 to 24 months. And we are almost 40 years later, and that still continues. And as long as that continues, we will be able to keep fueling this digital transformation. So there were some thoughts that we might be reaching the limits, but the ingenuity of people working in microelectronics have proven to be so resilient that we are still holding to Moore's law. And so as long as that continues, this increase will be unabated. Now, the digital world is producing profound transformations in some industries. So we are used to what's going on, let's say, in the financial industry. Banking more and more is becoming electronics and virtual. And through the power of data analytics, now you can anticipate if somebody is doing something fraudulent to you, and you get early warnings about what's going on. But it's not only in the mature markets. In Kenya, a mobile payment system based on cellular telephony was put in place about 6-7 years ago that allows people in remote locales to participate now of the economic life because they have means now to pay and buy and sell goods. And that system has captured over 25% of the Kenyan GDP, so all the transactions that are being handled through the system. Other industries that you wouldn't expect are also taking on digital technologies. Let's think about John Deere. So John Deere, as we know, is a premier company producing heavy machinery for the farming industry. Well, John Deere today offers a system whereby they place sensors in different parts of the field. Those sensors are all networked and connected, and they're measuring the characteristics of the soil. They're also linked to GPS, and through the GPS, they command and drive one of these big farming machines without a driver, so like the Google car. They produce the farming. They determine, based on the conditions of the soil that has been measured with the sensor, what should be the density of seeds that should be planted, at which depth, blah, 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 and then when they should be harvested. So a profound transformation. We could perhaps call that precision medicine of the soil, enabled by digital technologies. What about healthcare? Of course, healthcare is not immune to the digital transformation. So we hold in our hands fantastic abilities with mobile computing, our phones, our tablets. More and more, as I said before, sensors are interconnecting, and they are opening a completely new frontier for healthcare delivery. Now, one might argue about the speed at which healthcare is introducing digital technologies into the healthcare practice. We're not going to debate that. But it's very clear that some of the challenges that healthcare is confronting today, the only way, or one of the ways to be able to deal with those challenges will be through digitization. So what are those challenges? Well, they have been discussed in this conference already, but we have aging of the population, we have a rise of chronic diseases, and in many, many places, shortage of care providers to deliver the proper care. That's at the macro level. But if you look at healthcare in more detail, there are a couple of trends that are also very, very important that we need to deal with, and digitization really will help to deal with it. So in the middle of it, we have value-based drives with relentless pursuit to increasing outcomes and decrease cost. A consequence of that is that we are going to be facing a situation where more and more of the treatment will be outpatient as opposed to inpatient, trying to move care to lower acuity settings. But there is also another transformation and another trend going on, namely, patients now are approaching healthcare as consumers and are starting to demand from healthcare the same type of service as when they purchase other goods and services for their daily lives. So these are trends. We are here to stay with these trends, and in order to deal with those, definitely what is happening in the digital world will really help. Now let me start moving now towards diagnostic and treatment, and how digital is helping, and what are some of the transformations that are taking place on diagnostic and treatment. Now, when we talk about digital technologies, immediately comes to mind big data, cloud computing, mobile computing, sensors, networks, et cetera, et cetera. Absolutely. All that is part and components of digital. But underneath that, there are a couple of unsung heroes of the digital transformation that they are really helping to drive advances, definitely in diagnosis and treatment. And I'm going to mention two. And the examples that I'm going to give later on, in a way, are the results of these two. One is improvements and fantastic advances that have taken place in analog to digital conversion. Analog to digital conversion on chip. And you will see what the impact of that is. And the other one is huge advances that have taken place on real-time signal processing. And you will see how real-time signal processing is something that is helping, for example, create new ways to do treatment, in, for example, in image-guided type of intervention. So let's talk about the impact, again, of digital technologies on diagnosis as well as on treatment. And it's a very broad field, and in the few minutes that I have, it will be very, very difficult to go very, very deep on each one of them. So I will try to give a flavor of how these two underlying digital technologies are making an impact here. Let's start with imaging technologies. Talking about computed tomography, positron emission tomography, magnetic resonance. Thanks to being able to be more proficient at analog digital conversion, we have the ability now to basically digitize the data at the source of capture. And that has a profound impact, because digitizing the data at the source of capture, it's allowing us to be quantitative from the beginning. In addition to improving signal to noise, which of course that makes a big impact for accuracy of the readings, it's starting to help bridge the gap between just a description of images and putting numbers and trends to what is being measured. There are other benefits of this digitization at the source of capturing the data. And that has been, for particularly some of the X-ray based technologies, a huge, huge reduction in dose that has taken place in the last few years, and it's about to continue going forward. And that has proven to be extremely, extremely beneficial, not only for the patient, but also for the caregiver that is in that environment. So that's one example of impact, of underlying digital technologies, pushing the boundaries of diagnostic imaging, making diagnostic imaging a more quantitative enterprise. The other one that is right now experiencing a profound revolution is pathology. Dr. Cardo just alluded to the fact that, pathology is being digitized. Thanks again to the fact that now we can capture, basically, literally, on a piece of silicon, images. So we are experiencing the transition from looking at glass tissue through the microscope, tissue on a glass through the microscope, into basically digital images from the onset. And this is not only just the ability to digitize, the images. We are looking here to creating basically an end-to-end solution that can have profound impact into pathology, because it's not only creating the images, it's also creating a digital archive for those images, where later on you can come with all the power of data mining to basically make information out of that data. And indeed, we are very, very proud and excited about the collaboration we have with this institution to really push the state of the art on digitization of pathology. I'm not going to spend a lot of time here because people here in the audience are more versed, I'm sure, that I am on the role of genomics. But again, how we can make advances in sequencing has been predicated on the ability, again, of a digital signal processing. And again, the impact of being able to sequence on providing diagnosis and providing and understanding disease pathways and how that impact on personalized therapies is something that many, many people, I'm pretty sure here in the audience, are dealing on a daily basis. But again, keep this in mind, that all these advances, right, are again being fueled by the kind of exponential laws that I mentioned at the beginning. Now, let's talk about other advances that are taking place, and these ones are more in the field of real-time processing. So now we have with real-time signal processing, we have the ability of creating very precise, what I will call GPSs of the bodies, be for navigation to access tissue for biopsy from places of the body that in the past we were going completely blind, like the prostate, or being able to place payloads to attack malignancies, again, with very, very fine precision. So basically, I'm talking about huge advances that are taking place in image-guided intervention. And you say, well, image-guided intervention is something that has been already with us for a while. Yes, indeed, but now we have the ability to get into places in the body with millimeter accuracy that was not the case in the past. And the way you do it, you create a preoperative plan. That's the map. That could be, for example, an MR or a CT preoperative investigation. And then, and here is the virtue, you come with real-time imaging technologies like ultrasound, and that allows you, that's your GPS, allows you to navigate to wherever you need to go. But because of the ability now to do digital signal processing in real time, you can get, as I said before, to the places you want to go, either for biopsy or for treatment, with an accuracy that was unimaginable even 3 or 4 years ago. And this is not the end of it. We are, I think, at the beginning of what's going to be also a revolution in image-guided intervention, where we are going to be able to have finer and finer precisions going forward, in addition to new ways of navigating that are being explored in many laboratories around the world. Now, we place sensors today in people, we place sensors in homes. A lot of that is more passive. We collect the data and we react to that data. But looking forward, again, due to the ability of doing on-chip signal processing, we will have the ability to be more precise also and predictive on treatment due to home monitoring, for example, among other things. So bottom line is, and I hope that I'm giving the impression that these digital technologies that you don't hear much about are really helping us in diagnosis to improve the tools that we have at our disposal, making those tools more quantitative, making those tools better in terms of signal-to-noise ratio, and making those tools better in terms of capturing and processing data right at the source. And they're also helping us to develop a new type of procedures to deliver, for example, therapies. And they are helping somewhat to mix the boundaries between imaging and therapy. But life is more complicated. I don't have to tell you that if we want to deliver, definite diagnosis, first time right, and if we want to deliver a personalized treatment, it's not just improving individual components that deliver the diagnosis or deliver the therapy. And let's take this froze. So let's take one example, right? And that's illustrative of an oncology situation. And I'm pretty sure we can drive and we can draw the same type of situations and in many other parts of medicine. The point here is that when we look at the patient and how the patient transitions through this continuum of care, there are many, many interactions between different caregivers and care providers and the patient. And there are many, many nodes of interaction between the caregivers themselves. So we need to start thinking, yes, I can, through digital technologies, improve how do I do my MR investigation or how I'm going to deliver later on to my therapy. But that in itself is also not the answer to be able to optimize the whole. So if we abstract ourselves and we look and we take a system look at how do I handle and how do I optimize, among other things, to deliver diagnosis and therapy, this situation. So the first thing that comes to mind, and it's not a revelation, data is king. In order to be able to optimize how this is going to be managed, I need to have data available. Right? So it's not a big surprise. And the data has to be ubiquitous. So everybody who touches the patient, be in the hospital or outside the hospital, should be able to touch and have access to the data. So now we need to start thinking then that our diagnosis and therapy, right, and getting to optimize the overall continuum of care that the patient has to go through and the different pathways, the care pathways that the patient has to follow, needs to be optimized by the presence of data. And how do we do that? So in order to do that, we need to basically think and start be serious about the creation of more modern healthcare IT infrastructures. So the data will be clinical and non-clinical in nature, and we need then infrastructures that should be scalable, so you cannot avoid going to the cloud, but also should be with open interfaces in such a way that allows the different providers of data, be electronic medical records on one end, or be what's going on in the home on the other end, being able to integrate into this data flow for data analysis. So what are the demands that I think we should place on these infrastructures? And I'm not claiming what the architecture of this healthcare infrastructure should be, but at least when you start designing, start thinking, you start saying, okay, what are the design parameters and what are the things that I'm going to be demanding from this type of infrastructures? Well, the first thing is that it will be very, very important that this type of infrastructures support data integration of diagnostic information. So now, more and more, we are going to move into a paradigm where we need to deal together with radiology, pathology, genomics, functional data. All that needs to be integrated. Now, of course, it's not just the integration of the data, it's also the ability to follow the patient longitudinal throughout the data. Now, all these digital devices that we're creating right now are putting out so much data that we're going to be drawn. So what we need to do, of course, is create information out of the data, and these informatic infrastructures that we're talking about should be able to support tools for decision support systems, and should be able to not only support the tools for decision support systems, should allow also us to deploy these decision support systems. So here is where all the power of big data analytics, machine learning, deep learning, etc., will be applied to create these decision support systems to help analyze and help the caregivers predict what's going on with the patient. So, first big thing for this informatic infrastructure is the clinical data that we need. But as I said before, there is quite a bit of other data that is less of clinical nature, that deals also with how the hands-off between the different caregivers and the patient, and the different interactions between the caregivers. So we should be able to collect that type of information to do care flow improvement. Yeah? So now, care flow improvement is becoming more and more a science in itself. And again, in order to be able to improve a care flow within the hospital and the home, we need the data. But the important thing is that, and I'm sustained, that we cannot improve care flow if we forget about the clinical piece. So that is why this infrastructure should be able to accommodate both, should be able to accommodate clinical data, should be able to accommodate non-clinical data. And last but not least, as I said at the beginning, we're moving more into an outpatient type of world with patient engagement. So we should be able, through this infrastructure, to be able to help create and accommodate applications and solutions that and the patients more efficient than it is today. So here you see all digital technologies that I mentioned at the beginning coming together to help improve these care paths and the improvement of those care paths with the advances that we have in each one of the components of providing diagnosis and treatment on the whole will definitely lead to better outcomes, and truly believe will also lead to reduce the cost of delivering health care. So, in summary, digital technologies will definitely help improve healthcare delivery. And I mentioned what are the challenges, I mentioned what are the trends, and I believe that as those becomes more and more pressing, will really accelerate the incorporation of digital technologies into the clinical enterprise. One of the things that digital technologies will help is better management of the network, all these intersection points within the different care paths, as well as allowing a smoother transition to lower acuity settings for care. And of course, as I said, we are creating so much data that the drive to make information out of that data for decision support is there and will be enabled by digital technologies. Now, one point, the last one, I did not have the time to elaborate during this presentation, but as we move into this digital world, we need to think about new models for innovation. So this is an innovation conference. And when I say new models about innovation, I submit to you that going forward, we are going to be in a situation where innovation in healthcare will have to be more open. We have to espouse more rapid prototyping. We need to involve many more stakeholders in this triangle of open innovation, rapid prototyping, and stakeholders' involvement. And the innovation will be not only along the lines of what's my clinical practice or how do I improve my clinical enterprise. Innovation will also have to be along the lines of new business models. So that could be a talk in itself, but in a way, some of the principles of these new ways of innovation, right, are in practice right now on the collaboration we have in the digital pathology world with Mount Sinai, right? So it's an open innovation. It's we're thinking about, okay, how do we transform the enterprise, and what will be the models going forward, right, to really make sure that this gets translated outside outside just Mount Sinai as well. So thank you very much for your attention. I hope that I was able to convey that digital is here to stay, is making big impact on diagnosis, treatment, but also the big impact will be on how do we manage diagnosis and treatment as a part of a continuum of care of the clinical enterprise. Thank you very much.